Okay, for this next part, I need to get changed, and while I'm changing, I followed the research articles that were or presentations that were done before, and also through their studies for the last few years here. This is something you won't see me do on a normal day, by the way. But I wanted to know, Rachel, was there any way to check the DNA? Was there any DNA material in those teeth? No, I have a different question for you, Sarah. Because they know the code for Neanderthal and. Aha. Okay. And Sandra was going to ask you, what were the special conditions that you needed to induce cemento formation in the petri dish in the lab?
There are special ingredients that we add.
I hope everyone can hear the answers here because I asked the questions, but.
There are special ingredients that we add to the medium that the cells are.
Petel. What did you add? No hormones? No hormones. Okay, you answered my question. Okay, well, anyway, I put on my my lab coat now because during this last session, what we're going to do is get a look at some of the things that our residents have been doing while they're in the clinic, in the department. It's not all just test tubes and going to run into caves, by the way. We do other things. And now you're going to get a glimpse of it. Now, the other thing I'd like to mention is that you understand this is an international program. It's not just international because of the residents that arrive from multiple countries throughout the history of the program. Also, the instructors are individuals that have received their orthodontic backgrounds from a variety of places throughout the world, which adds to the flavor of what our department has to offer. Now, I want you just to imagine that it's not Friday morning, it's Thursday morning. Thursday morning in our department, we spend several hours looking over basically 8 or 9 slides that the residents put together, maybe 10 slides, that will encompass an entire patient's pre-treatment diagnostic records. This includes pictures of the patient's face, pictures of the patient's teeth, pictures of their radiographic information, and then the fun begins, which is why you heard some of the accolades at the meeting yesterday about why the department has a special flavor to it as well. There's an intellectual discussion, there's a philosophical discussion, there's a medical discussion, and this is why I would like to second what Professor Eli said this morning, that you're not getting training. Okay, where I went to study was called, you were a fellow in orthodontics. You joined a fellowship. It's not a guild. It's not a trade. It's a profession, which means you never stop learning. Okay, a trade, you go, you learn how to cut with a saw, you develop your skills, you become an excellent craftsman. When you become a doctor, you are never done being a student. And what we're going to see now is the kind of things that the vast variety of things that our residents have undertaken in their clinical studies here in the department. And you're going to see a variety of different treatment approaches. You're going to see a variety of different techniques and philosophies. And this will give you a taste of the kind of things that we did here in the department together. First, I'd like to call, and by the way, I'm not going to mention anyone's last name because I grew up in the United States and my last name was butchered everywhere I went. And then I'm just going to mention people's first names. So, Talya, I would like for you to come up first. And Talya's going to show us a technique which is very, we call it extremely modern kind of approach. It's not what you saw when Professor Zackerson was showing us we call it a mitzvah here in Israel. He was basically doing the work of God, essentially, in treating some of those cases. The kind of appliance you're going to see now is something that is not brackets on teeth. It's doing also little miracles, but in a different kind of a way. Talya, please. The other thing, on Thursday mornings, we will go over a case. It could take 2 hours just to discuss one patient. We're not going to go for 2 hours with each patient here. But we're going to get a good idea of what goes on.
I think this is more my height. Hi, everyone. I'm Dayan-Sayer, and I am from Tel Aviv. Tel Aviv is the second most populous city in Israel, and it has beautiful beaches, beautiful coastline, and it is known as the city that never sleeps also. But many people think that this is due to our 24-hour culture. The beaches, the restaurants, the bars, the cafes. But I can tell you that it is actually referring to the Tel Aviv orthodontic postgraduate lifestyle of never-ending studying, 24-hour article reading, and fun journal clubbing. Okay, ta-da. And during our exam time, then it's most obvious because then we really don't sleep. This is my family that I really want to thank for their support. I couldn't have done it without you. Sorry. My parents and my husband, Erez, I love you. I really couldn't have done it without you. And my son, Aviv, who is now at the kindergarten back with the family day with the grandparents again. But you can see that I take care to take early measures to show my son what he really needs to do when he grows up. So the case that I am going to present is a case that I treated under supervision of Professor Vardimon here. And this is a patient that came to our university clinic with the need for orthodontics. He's a 32-year-old adult male, and he doesn't like his smile. And he's asking us to do it in an invisible way to straighten his teeth. He wants to do it with Invisalign. He has symmetric face within normal range. And what is Invisalign? Invisalign is an invisible way to straighten your teeth. It is actually 2 words. One is invis, standing for invisible, and align, standing for straightening your teeth. So invisible way to straighten your teeth. After examination and assessing that the patient is a good candidate for Invisalign treatment, we take records. We take photos and x-rays, and I take impressions of his teeth. And this is all sent to the Invisalign lab in Costa Rica, which makes an imaginary treatment plan from the beginning of the malocclusion that you see now running on the screen, from the beginning of the malocclusion to the finished result that we like. And this is called a setup. This is very good for us because we can make as many setups and as many imaginary treatment plans as we want and see them from beginning to the end and then choose the best treatment plan for our patient. After we approve the treatment plan, the lab makes a hard glove, clear hard glove to fit over the teeth, and this is called an aligner. This is actually what aligns your teeth. It is clear and transparent, and the patient is wearing it all day except for meals and for brushing. And this is how we do it. The course of treatment involves changing these aligners every 2 weeks, and each aligner slowly moves the teeth into a straighter position until reaching the final smile that we want. Sorry, Ben. Make it louder. I have another movie afterwards. Can you make it louder? From the computer? Mr. Maximus? No. This is the aligner that she puts in the mouth. So don't call today, come to us instead. Don't call today, come to us instead. You can treat with us. So this patient profile is straight, orthognathic. We like what we see. It's pleasing to our eyes, and we will keep it as is. When he smiles, we can see spaces and a midline diastema. We can see that the upper midline is off to the right. And we can see that the level of the incisal edges of his anterior teeth are malaligned. In his x-rays, we can see the reason for the spaces. He is missing 2 upper teeth. Teeth number 2 he's missing. And so the teeth marked here number 3 are instead erupted next to the incisors and has taken the place of the lateral incisors that are missing. We can also note his bridge work and some faulty restorations that he will need to fix before we begin his treatment. Clinically, we can see the laterals, the tooth number 2 that is missing. So you see tooth number 3 standing next to tooth number 1 on both sides. And in the lower arch, you see the crowding, and you see that the midline is off to the right. Usually when 2 lateral teeth are missing, we expect 14 millimeters of space. In this patient, some of the space has already closed by the back teeth moving forward and by the front teeth moving back. His malocclusion is class 2. In the upper arch is slightly asymmetric. Hi, Aviv Motek. מה שלומך, Motek? The upper arch is slightly asymmetric and it has 6 millimeters of space in the anterior area. The lower arch, you can see moderate crowding, and you can see some bad restorations that need to be replaced. So when we have missing teeth, then we have 2 options. We can open the spaces for the missing teeth and replace them with 2 implants, or we can close the spaces so that with any residual space be left posterior to the canines, so not to be seen in smiling. And the canines will be placed instead of the missing laterals and will be reshaped to resemble the laterals. In this case, we will not need any implants. The treatment plan that was chosen in this case was to close the remaining spaces, placing the canine instead of the missing laterals and reshaping them to resemble laterals. In the lower arch, we decided to extract 1 incisor where you see the X marked and utilize the extraction space to align the lower arch. This is a screen capture of the internet program of Invisalign that we work with the patient's chosen treatment plan. Usually with Invisalign, the total number of aligners and length of treatment is specific to each individual patient, and it depends on the complexity of the treatment and tooth movement that is required. Here, the treatment is complex for Invisalign. It's complex for Invisalign because we are extracting a tooth, and we want to close this extraction space while keeping the teeth upright. And this is a difficult movement for Invisalign. This is why you see these red bars here. These are called attachments, and they are formed in the mouth. We form them clinically in the mouth by placing a tooth-colored composite, not red. And this helps the aligner to grasp the tooth better, like braces, and to move them while they're upright and better control in the tooth movement. Also in this case, smaller movements are needed to allow better control of tooth movements. So this is why his treatment is estimated to be 2 years with 39 aligners in the lower arch. Okay. Let's watch the internet program in action. Let's watch the setup that we've chosen for this patient. Here you see that Invisalign places a false tooth that we can ask from them to place. And this is so to give the patient an answer for aesthetics also during active treatment, because it's camouflaging the extraction site. So you will see it running on the screen in a second. You see how the extraction space is utilized to align the lower arch. And if you look now at the upper arch, you will see how the spaces will minimize, with the residual spaces be left posterior to the canines, so we don't see it during smiling. This is about half a year into treatment. About half a year into treatment, you see the alignment of the lower arch beginning. You can also see that the spaces in the upper are beginning to close and minimize. This is about a year, a little bit more after beginning of treatment. You can see that the alignment of the lower arch is continuing to improve. You can see that the spaces are minimizing, and already the smile aesthetics are very much improved, and the patient is already happy. This is at the end of the set of aligners. At this stage, we reassess. We reassess the upper arch in regard to the position of the canines, because we will want to reshape them and make them into laterals. And we also reassess the alignment in the lower arch, the level of the upper incisors, the incisal edge, which is now leveled. And another good thing about Invisalign is that every time we can compare with the clean check, what is called the imaginary setup that we've talked about before. And we see that it pretty much compares. And we have a very slight refinement to make. The same reassessment appointment, in the same reassessment appointment, we also make a mock-up of his canines, and we shape them into laterals. We do this with the patient and the prosthodontics. And what I did here, I added a tooth-colored composite to see if we like the place of the canines and what else we would like to do. We can see that the aesthetic result is pleasing. The patient is now smiling very nicely. You can see the beginning smile of the patient and how he is now after the mock-up, how we expect it to finish. And we are very happy with the result, and we are glad with the aesthetic, how it looks. Thank you.